when I saw this circling around the news early this morning at like 4 o'clock in the morning, I was like, really? That doesn't sound right. So I pulled up a couple things, and yeah, sure enough, yeah, it's about right. So they're going based upon 1%. If 1% of their population has it, then that's 100,000 people in the state. So you can do the math from there. If this is 3%, even 2% fatal, that's a lot of people, man. So let's read this, and they are going based upon the official estimates. A top health official in Ohio estimated on Thursday that more than 100,000 people in the state have coronavirus, a shockingly high number that underscores the limited testing so far. And the testing is limited. There are doctors that are taking components from kits used to test for other coronavirus and other viruses, and they're basically coming up with their own kits because the parts are in high demand and low supply. Ohio Department of Health Director Amy Acton said at a press conference alongside Governor Mike DeWine that given the virus is spreading in the community in Ohio, she estimates at least 1% of the population in the state has the virus. At least 1%. So that's at least 100,000. Now, out of those 100,000, you can do the math. 3%, let's say 2%, let's even say just 1%. That's a heavy toll. That's a very heavy toll. 1%. 1% is what? Still 10,000. We know now just the fact of community spread says at least 1%. At the very least, 1% of our population is carrying this virus in Ohio today, Acton said. We have 11.7 million people, so the math is over 100,000. So that just gives you a sense of how this virus spreads and is spreading quickly. She added that the slow rollout of testing means the state does not have good verified numbers to know for sure. And that's the problem. We don't know. The numbers are going to be higher than anybody thinks because we don't know. We're not testing enough people, and we don't have enough tests to test enough people. It's absurd. It's absurd. Our delay in being able to test has delayed our understanding of the spread of this, Acton said. The Trump administration has come under intense criticism for the slow rollout of tests. Dr. Anthony Fauci, a top National Institute of Health official, acknowledged earlier Thursday it's a failing that people cannot easily get tested for coronavirus in the United States. Not everyone with the virus has symptoms. A lot of them are carriers and they can get other people infected, but they don't show any symptoms. And about 80% of people with the virus do not end up needing hospitalization, experts say. However, the virus can be deadly, especially for older people and those with underlying health conditions. Even 2% is a huge, huge number, man. It doesn't sound like much when you roll it in your head, 2%. But that means out of every 100 that it's fatal to 2. Now do the math in your head. That's a lot of people. The possible numbers in Ohio are a stark illustration of how many cases could be in other states as well, but have not been revealed, given the lack of widespread testing. And I've said from the beginning again, testing. We needed to cut out the criteria. We needed to cut out everything. We needed to be able to have the tests available and be able to test everybody. It should be free, and everybody should be tested. We shouldn't have criteria. That's the only way you're going to be able to track it, stop it, control it, maybe. Well, it's too late now, but more than 1,300 people in the U.S. have currently tested positive for the illness, according to data from Johns Hopkins University. 1,300, I believe, we're going to look here live while you guys are watching here. We're going to come down here to here. 139,637. So 1,300 in the U.S. have tested positive. So let's come down here to the United States. Bear with me. Thank you, guys. 1,832. So in the span of this report, 1,300 to 1,832 cases and 41 deaths. And this report was published at 5:10 p.m. yesterday. So 5:10 p.m. yesterday. So From 5 o'clock yesterday, less than 24 hours, we have an additional 532. Vice President, well, about 36 people in the country have died. It's more than that now. It's much more than that now. 41. Vice President Pence, who is overseeing the administration's coronavirus response, said earlier Thursday that the U.S. can expect thousands of more cases. Yes. We probably have thousands of more cases as we speak right now, this very moment. We just don't know it. Ohio officials are saying they are taking major actions to try and slow the spread of the virus. They're closing schools in the state for 3 weeks and banning large gatherings of 100 people or more. And more states are doing this. My state has done this. They have banned gatherings of 250 people or more. It's virtually a soft lockdown in a sense. Streets are not closed or anything, at least not yet. National Guard hasn't been called in to enforce a quarantine or anything yet. But if this gets worse, in order to save the country, they will take drastic action. Rest assured. The state currently has just 5 confirmed positive cases. That's exactly what we have. And 6. We have 6. New Mexico has 6 confirmed cases. And 30 negative tests. Acton said Thursday it appears that the number of cases in the virus doubles every 6 days. As other experts have as well, she urged actions to slow the spread of the virus to avoid overwhelming the capacity of hospitals. Banning large gatherings and stopping school is part of that process. And flatten the curve. Hashtag flatten the curve. Wash your hands. Keep social distancing. Clean. Sanitize. That will slow the spread. It's not going to stop the spread, but it will slow the spread, giving our healthcare system time to deal with it. We don't want everybody going in all at once. Then we're going to be overloaded, and then we're going to have a domino effect, which is going to make things worse. Don't overload. Don't contribute to overloading our healthcare system. Hashtag flatten the curve. Hashtag flatten the curve. We're all sort of waking up to our new reality, she said, adding later that the state is in a crisis situation. Noting the concerns about hospital capacity if the numbers of cases spikes too quickly, Acton said, there are only so many ventilators, referring to machines that allow people to breathe when they cannot on their own. Models indicate the number of cases could peak in late April to mid-May, she said. If people are not seriously ill, she urged them to stay home, said only the 6 people who most need help are showing up at hospitals. This will be the thing this generation remembers, she added, and that will be the thing for generations to come. From now on, it will be a thing of, maybe not shaking hands or not hugging. Maybe people will do the chicken shake or wave from a distance or something. But yes, this will definitely change things, how things operate on this planet. For a very, very, very long time. Especially if this thing becomes phasal and it keeps coming back every year. You guys stay safe. You guys stay informed. I will keep you guys informed despite what YouTube says. Give me a like, a thumbs, a comment, a share, a subscribe, something. Let YouTube know that you don't mind hearing the news as it is. And that they shouldn't stifle the news. They shouldn't stop information from being spread. We cannot allow them to be the gatekeepers of our information. And remember, hashtag flatten the curve, just as it sounds, flatten the curve. It's good advice, not only for this, but all year round. I love you guys. Stay informed. I will see you on the next one.